those of you, I'm simplifying the conversation so that if you are not familiar with these graphs, you can still understand. The left side is your blood pressure, and then the bottom here is your salt. So your salt is 50 and 100 and 150 and 200 and 250. So it means that the more salt you take from 50 to 100, your blood pressure goes up. 150, your blood pressure goes up. 200, your blood pressure goes up. 250. So salt is directly connected to blood pressure. What about potassium? Everybody asks me about the potassium. It's also a mineral. Potassium. If you are healthy, not with kidney problem, if you are healthy, actually eating potassium is the opposite of eating salt. You see here, this is 500 and 1,500 and 2,500 and 3,500 and 4,500. So the more potassium you eat, you see that the blood pressure goes down. Blood pressure goes down. If you're healthy, eating banana, orange, and all those things actually brings down your blood pressure a little bit. And that's very good, right? So this is very good. What about alcohol? Why is alcohol so important? Again, this is the amount of alcohol that, you don't drink alcohol, or you drink one, less than one, or, and you drink as much as 60 ml. This is milliliters per day. That's basically about, 2 ounces of alcohol a day. The more you drink the alcohol, the higher your blood pressure. The more you drink, the higher your blood pressure. What about the alcohol and your race and the hypertension? We are now combining all of them, right? The alcohol, the race, and the blood pressure. So here is your alcohol consumption. If you are, these are men and these are women here. This is white, black, and Asian people. Let's talk about the black people. You see that if you are black and you have the you have the alcohol consumption that is in this range, your blood pressure goes up. That is, if you're drinking more than 6 a day, your blood pressure goes up. Right? Whites, it also goes up in whites, but not as much as in the black people. It doesn't have an effect in the Asians as much as it has on the whites and the black people, but more in the black compared to the white people. What about the weight? Okay, again, this is your weight measured by what we call the BMI. Okay, so between 30 and 39, 40 and 49, 50 and 59. For the man, you see that as your body weight goes up, your blood pressure goes up. And for women, same thing. As your body weight goes up, your blood pressure goes up. Again, these things don't happen right away. They are cumulative. They happen slowly, and until you develop the problem. So hypertension is really problematic. When you have hypertension, right, this is what happens to your heart. Your heart is going to be weak very soon. It's like beating like crazy. Your heart is going to weaken very quickly. It's going to cause a stroke. It's going to cause a kidney problem, which is what we're talking about today. It's going to cause all your blood vessels to be like very thick. They're like very thick. Nothing can go through. And then you develop various problems with amputations and all that stuff. So blood pressure is really very bad. So when you know how to manage the blood pressure as we have described, right, you can avoid all these things. You're avoiding the kidney, but you're also avoiding the heart. You're also avoiding the stroke. And you're also avoiding the stuff in your legs. So what can you do? So these are things, these are non-medication. These are things that you can do to lower your blood pressure without the medication yet, right? So let's see what it is. If you reduce your weight, you can reduce your blood pressure by 5 to 20 millimeters of mercury. That's a lot. If you bring your weight down to your ideal or close your ideal body weight, your blood pressure will come down by 5 to 20 points. That's a lot of points. Okay? If you eat what we call the DASH diet, which is the one that I showed you, 50% of your plate has fruits and vegetables, your blood pressure will come down by 8 to 14 points. That's a lot. The plate that I showed you, if you are actually eating that, your blood pressure will come down by 10 points. If you follow the salt intake that we discussed, your blood pressure will come down by 2 to 8 points. That's a lot. If you increase your activity, you are, physically active 11 minutes every day. That's the simplest, and I try to preach it all the time. 11 minutes every day of physical activity will reduce your blood pressure between 4 and 9 points. That's a lot of points to lower your blood pressure. And if you lower your alcohol consumption to just, social, you can lower your blood pressure to between 2 and 4 points. So just imagine if you were doing all this stuff. Let's say you got 5 points from here. You got another 5 points. That's 10 points. And then you got another 5 points here. You get 15 points. You get another 5 points here. That's 20 points. And you get even 3 points from here. That is 23 points. Man, you're back to normal again. If your blood pressure was 140, if you do all this stuff, your blood pressure is now 118 systolic. You're done. You don't need medication whatsoever. You're done. Then your heart is happy. Your kidneys are happy. And your brain is happy. No strokes. Your blood vessels are all clean and very nice. No problem. Just by doing what we just discussed, you can lower everything. All your risks will go away. Okay, so the next one is the diabetes. Remember I said 78% of the problem is from 2 diseases. So now we're going to talk about the diabetes. We define diabetes when your blood sugar is more than 126. So you have to remember that number. When your blood sugar is more than 126, more than 2 times, you have diabetes. Okay? There's another way to do it. It's called the A1C, and everybody must know that word, A1C. If your A1C is 6.5 or more, you have diabetes. Okay? And 10% of the people in the USA, 10%, that's a lot of people. We have, 330 million people in the United States. 10% gives you 33 million people have diabetes. So 50 million people have hypertension, 50 million people have kidney disease, and 33 million people have diabetes. It's amazing. It's amazing. And the blacks have more diabetes than the whites. Just amazing. So who will develop diabetes? If you are older, the older you get, the more likely you can develop diabetes. So with age, you have to be more cautious, not less cautious. As you get older, you become more cautious. Don't eat the sugary stuff. All the stuff that say limit, limit, limit. Don't eat them. If your weight is more than your ideal body weight, your chance of developing diabetes is high. If you're not exercising the 11 minutes every day, the chance of developing diabetes is very high. If you already somebody in your family, like first degree, your mother, father, brother, sister, has diabetes, your chance of developing diabetes is high. And of course, the risk factor always comes in. And if you were a woman and you develop diabetes during pregnancy, you have a chance of developing long-term diabetes. If you already have hypertension, you have a chance of developing diabetes too, because they're all connected. And then there are some medications that can also cause diabetes. So if you're on medicines, always remember to ask your doctor, especially when they're prescribing you a new medication, right? Does this medication cause blood pressure problem? Does it cause diabetes? You have to ask that question, always, for new medications. Very similar to the high blood pressure. Look at what diabetes does to you. Diabetes can damage your heart. Diabetes can also cause stroke. Diabetes causes the kidney problem that we talked about. Diabetes can cause the blood vessels to thicken. So when you have the two of them, each of them does it separately. And then the two of them, what do you think is going to happen? When they combine, when you have hypertension, diabetes, then the risk is even amplified. The risk is very, very high if you have the two of them, hypertension, diabetes. Okay? So, that is why the kidney disease is so much in Black people in the United States. So you look at the prevalence of kidney disease in all the races, Asian Americans, the Native Americans, the African Americans, and the white people. You see that this purple line here, the African Americans, the Black people have the highest rate of kidney problems. And it's because of those two issues. Because if your risk of developing hypertension is high, and your risk of developing diabetes is high, then what do you think is going to happen? You're going to have the highest risk of kidney problems. So it's really, so we need to really be like, preach this to everybody. Anybody who gets this message should transmit this message by like 1 million times, because this message has to get to everybody. We are at the highest possible risk, and we cannot keep dying because of kidney problems, because of hypertension. It's prevent. I already told you, just the stuff that you can do to bring yourself from 140 blood pressure to 120 blood pressure, they are doable without medication. And if you add the medication, boom, you're done. Now you can be normal, and normal means your heart is fine, your everything's healthy, everything is controllable. Okay, but it's just not the right thing for Black people to be carrying the burden of this disease in the United States. It's not really the right thing. So across the country, you know, there is a program called the National Kidney Disease Education Program. We are part of the program. Our job is to educate the public on these issues, right, and motivate people to test for kidney problems, so that if we pick, and hypertension, diabetes, so that when we pick it up early, we can knock it out. We will bring it back to normal. And if we're able to bring it back to normal, then you don't develop kidney disease. You'll be normal. So this is ongoing. Most primary care clinics have these programs. I give a lot of talks on this program across the country. And our mission is just to make people just be aware of the numbers. You have to know your numbers. If you know your numbers, you have control. If you don't know the numbers, you don't have control. So you have to know what is normal blood pressure, what is normal sugar, and what is my blood pressure, and what is my sugar. You have to know these things when you go to the doctor. Don't go to the doctor and the doctor says everything's fine, you walk out. No, don't do that. If the doctor says everything's fine, you say, what is my blood pressure? And write it down. What is my sugar? Or what is my A1C? And write it down. I'm going to tell about the kidney function test. You ask for your kidney function test. What is my number for the kidney? You write it down. And you track it yourself. Right? So everybody must be aware of these numbers. And when you are aware, you have control. If you are not aware, then you are depending on somebody who has control, and that person may not necessarily have, remember you all the time. So what do? The goal is to always make sure that the blood pressure never exceeds 140/90. So that is primary one, goal number one. I already told you, with the lifestyle, you can bring this down to 120. And if we add a little medication, we can get to the 115. So that's good. So this one, we can do it. It's just that people don't do it. I can do this one. Blood sugar, right? I told that the diabetes A1C more than 6.5. So ideally, it should go back to less than 6.5. But there's some little room. If it's less than 7, you're in good shape. So when you go to the doctor, you ask for your A1C. What is my A1C? It has to be less than 7. If it's less than 7, you're really doing perfect. Your kidneys will be happy. Your heart is going to be happy. Your brain is going to be happy. All your blood vessels are going to be happy. Okay, then we will check the cholesterol and then fix the cholesterol as well. Then the nutrition, we already talked about the diet and the nutrition and all the other stuff. You have to do them. And then if there's a need to add other medications to slow down the kidney problem, we always do, right? If you have already developed the kidney problem, and they actually work, we can actually slow it down so that instead of when the kidney problem happens, most people would need dialysis in like 6 or 7 years. So listen to this one, it's serious business. When you have a kidney, if you go and you get your first diagnosis of kidney problem, there's a very, very high chance that you need dialysis 6 to 7 years. So you don't want that at all. You don't want that diagnosis, right? So you want to get early diagnosis of blood pressure, diabetes, control them and get rid of that diagnosis. But this is what I get in the clinic every day. When I want to talk about these things, this is what I get. The patient, doc, I can't do this. The carbs, they fill me up, and then I don't know what to eat, because if I don't eat the carbohydrates, I don't know what else to eat. Nothing fills me. I feel hungry the whole day. I love the eggs for breakfast. I love the juices, shrimp. I love the red meat. I love to sprinkle a little bit of salt. I love all my time. I have very little time. I work all the time. I have very little time to do anything else. There is excuse for everything. And then, please, doc, don't make it more complicated, because I don't know whether I'll be able to do it, right? When you start from there, you can't make it. It means your blood pressure is going to go higher, it's going to get worse. Your diabetes is going to get worse. And what is going to happen is that you're going to end up with the damage to the heart, to the kidney, and to the brain. And at that point, it becomes less reversible, especially for the kidney. Kidney is very, when you have a heart problem, sometimes you can reverse it and it can be long term. But when you have a kidney problem, the kidney just knocks out. It never recovers. It never really repairs. When you lose like 50% of the function, you can't get back the 50% that's gone. It becomes like a scar tissue, right? And then once the kidney disease happens, it always continues to go down. It's not like you have it and then you are stable forever. No, you're gonna have the kidney problem. It's stable for 2 years, then it goes down. Then another 2 years goes down. Then by the 6, 7 years you're on dialysis. That's how it works. So these excuses just make the whole situation of kidney disease much, much worse, and we don't want to do that. So I'm going to repeat the lifestyle again. Reduce the weight. Now you know your ideal body weight. You increase your activity. This is 11 minutes. I'm stressing it because the 30 minutes 3 times a week seems to be a little hard on people, and they can't cope up with the treadmill 30 minutes and all that stuff. But there's now new information that came out saying that if you actually are exercising, any exercise, 11 minutes, that is any exercise that will make you sweat a little bit, for 11 minutes every day, you are in good shape, okay? And then I already told you to reduce and then make it less of these things, moderate consumption of the alcohol, the sodium, the fat, and the cholesterol stuff. We already spoke about that. Now you know your plate. 50% of the plate should be fruits and vegetables. It will give you everything that you need, including your vitamins and everything, right? And then we already said the potassium actually reduces your blood pressure if you're normal. If you have kidney problem, we avoid the potassium. But if you don't have kidney problem, potassium is really very good. Okay. And then don't smoke. I mean, smoking just makes everything worse. Now, if it fails, what happens, right? What happens is that, you are likely to need hemodialysis. And this is not an easy thing. Hemodialysis means we're going to be cleaning the blood. We take the blood from your body, we take it into the machine, we clean the blood, and then we'll bring it back to you, right? And you have to do it 3 times a week. This is not pleasant. I just wanted to let you know that I have been able to, me and my colleagues were able to set up a dialysis center and a kidney disease center in Accra. So because I was getting a lot of calls, why don't you do something in Ghana to help, all that stuff. So I put a team together, and now we have a beautiful kidney disease program in Yahoo Clinic. Anyone, your family members, if they have anything, blood pressure, diabetes, and they want it controlled, they can call the center. It's called Sahel Health Ghana. If you go into the internet, just type Sahel Health Ghana. The internet, it will pop up, and all the information is there. The doctor will see the patient and manage it. We don't want people developing kidney problems. So there's a doctor always there seeing patients with kidney problems or high blood pressure, making sure that everything's under control. And for those that, we cannot, help because the kidney has already failed, there's actually a dialysis center now at Yahoo Clinic. Very nice, like the American standard. It does everything really very well. I just want to make sure you know that there's a resource if you are stuck trying to figure out what do I do with my family member who's either traveling from the United States to Ghana or in Ghana. We have at least something that can help the patient or help you. But we don't want that. That's why I keep stressing going back to the original conversation. There's another way to treat if your kidneys have failed. It's called peritoneal dialysis. This time, instead of doing the dialysis through the blood, we do it through your stomach. It's not really your stomach, it's the space around your stomach. We put this solution into the space around the stomach. For some reason, the space around your stomach, your bowels, it behaves like a kidney. If you put this special solution into the space, it will remove the toxins over like 4-hour period. You take it out and put new solution. And people have to do like 4 or 5 times a day. So that's everyday treatment. There are now machines that can do it overnight, so that's a good thing, but you have to do it every day to be successful. But it's amazing that the body, that is the lining around the small intestines, the large intestines, the stomach, the lining almost behaves like a kidney. So if you put this solution inside, it will just wash the body of all the toxins for that time, you take it out and put new solution. And that's how it works. And then if there's an opportunity to do a kidney transplant, the kidney transplant is really the best way to do it, because the kidney transplant really replaces the kidney 100%. But you have to be on medication for the rest of your life. So, but we are all on medication. You know, you have to take hypertension medication or whatever. So if you get a kidney transplant and your kidney is working beautifully, and you're taking 1 or 2 pills to keep it, that's a good thing, I think. So that is how we manage kidney disease if the kidney fails. But we really don't want to get here. We want to be on the preventative side and be healthy, right? The healthy side is what we want to do. So I would like to conclude here by, making a few points. The first one is that know your blood pressure. Just know the number. Keep it less than 140/90. Don't leave the doctor's office unless you know your number. Know your A1C. Keep it less than 6.5. Don't leave the doctor's office unless you know your A1C. Maintain good diet. Wait and do exercise. The good diet is that plate I showed you. 50% of that plate should be fruits and vegetables. You're going to get all your minerals and your vitamins from that. Use the ideal body weight and keep around the ideal body weight. A little above the ideal body weight is not a problem. Up to 20%, 30% not a problem. But once it begins to approach 20% more, it have problems. And then remember to do the 11 minutes of exercise once a day. Right. Always ask about this is the kidney number. It's called EGFR. That's the kidney number. The EGFR is the kidney number. If it is less than 90, you need to see a kidney specialist. Right? So when you are in the doctor's office, you went there, they did your blood work, and all these things are always in the blood. These are routine blood work. They're always in there. So ask for these numbers before you leave the office. And then spread it to your family members and friends and neighbors. Let them know these numbers, because when you know your numbers, you're really in control. And you become actually more conscious about your health. And because you're more conscious about health, you have more ability to do new things and try new things that will bring you closer to normality. And of course, prevention is always better than sorry. So that is what I wanted to cover today. I hope I've been able to address some of the issues that were sort of not clear in your minds. And I'm so grateful that I had a chance to talk to you this morning. I want to thank Ms. Boateng for organizing this. We've been talking about it for a while now, but I know we're all busy, and then it never, came through, but we finally made it. So I'm so happy with that. So Ms. Boateng, thank you so much. I have been working with Ms. Boateng for more than 10 to 15 years. So she's an amazing woman. She's one of our leaders, nursing leaders at SUNY Downstate. She manages an entire floor of nurses. It's just amazing what Ghanaians can do in the United States. I think, it's just a talent. Ghanaians are typically really, really well, they are knowledgeable, they're well liked by the communities that they serve. Anywhere I go, I always get compliments about Ghanaians, and it's just rewarding to just feel like that. So thank you, Ms. Boateng, for organizing this. And my last thing is I want to add to what the Reverend said about the blessings, but I want to say God bless your kidneys too, in addition to that. And I'll stop here and take any questions.
Okay. Doc, that's here. We shall for the catcher mono say it's going to be power. And I'm Doc, Eddie Amayno. Yabaka home, actually, Nasida Betree. But I say, baby, I drew no. Question time. Now, Pacho said, ye be ye say, baby, I want to mean Kasa now per se, Ubisa question now, Mr. Obitim, the to chat and also a binum at the kind ISI, ye be picking in Anna, Doctor, and ya about train no church, you say, Ubitim so, who raise you hand in that, was some form you ha, meet me after Jawana, meet me Abudina, what basso. Enti Ubaswa now question no, what bisa. Na Dr. Nto you no. Enti no before I say me chat no, my brother Ebenezer Aduku apagya ne sa nti bro obetimi abusa question no obusa question ni bia afia be chat room ni answer chat questions kakra na afia asamba back na bi emu ta na manfo so ama omo nsa so bro acho obetimi afa obetimi awmri to na obusa question.
Your doctor, your CP, in fact, your presentation is so crystal clear, and we need it. Some time ago, I had a parishioner who had kidney problems. Based upon said you will see church so when your kidneys now reversal will be hard. Now I had this parishioner was by him, and the doctor came in and he said, your situation is reversible. Into Abia, we share with the so everything it can get better. Based upon what you said, what did the doctor actually mean? Because sometimes we want to just be sure, say, at some point, if somebody has kidney problems and he does everything you have instructed as, maybe they can get it back perhaps 20, maybe 75% or 80%. Which me I change kakra akamwana.
Yes. Thank you for the question. Obviously, what I spoke about is what we call the chronic conditions. Yeah. That is, if you have long-term blood pressure issues.
Doctor Wadaruma, my chica crambrem, Nayanum Bia in Tantitrin, a brofun, Papa Wadaruma.
Oh, I understand the tree very well, but my proficiency in tree is not that well to explain these things as much. But we can have someone interpret if possible. Is that possible?
Yeah.
I can say it and then you can interpret fluently for the person to understand, right?
Your doc,
yeah. But I understand everything fluently, but I can't express it the way I want to express it in English. So what we are discussing today is the chronic conditions, things that are long lasting. That's the difference. There are some short-term conditions that can also cause kidney problems, and for the most part, the short-term conditions are actually reversible. They are actually reversible. For instance, if you have an infection and you are taking antibiotics, right, or certain medications, they can damage the kidney, but they are temporary. If you stop the medication or the infection goes away, the kidney problem resolves. Can you explain that?
Yeah, the doctor Professor Chen said, normally a cancer short term one, a buy the bit me a sanko. It's an idea of what da and never bows for. And says, when ya no, if you say na, fat a droby. And I say, what to a droby soon, I drone by and who effects in this idea and my wa. So would you drone far and also it be free ho. Until no be a bar at a short term, a back and rep cacre be not a sanko. It depends on the situation at the time.
Yes, and also, so infection is one of them. Dehydration is if you're not drinking enough water, or you're taking too much water pills, and then you are dehydrated, or you have heat exhaustion. You have heart failure. They can also all can contribute to kidney problem, but they are usually reversible. So the infection, dehydration, and medications. I just want them to understand those three things.
Hello?
Yes, please.
Please, can I ask a question?
Yes, please.
To express myself, I'm speaking tree.
Yes.
I always had this thing, muscles pull. About 1 hour, I can't stretch my legs and the feet. At times, me my name to an me to a muscle pull the best sorry, mesusa. Axel said a very relaxing answer. So 1 hour, nothing relaxed, me free. Na me name ni entia me nya sa muscle pull. Before then, also me nya stroke pain, but I was cured. And I was high blood pressure. There be less no na ye 140. Just recently, 3 days ago, I went to my appointment, and I almost say hi, do into woman man drew. So no, a call from Kakra na basuru. And yes,
Okay. Okay, I understand. I don't need interpretation. I just need someone to interpret what I say. So her diet, I suspect that her diet is not rich in calcium. That is what the issue is. The muscle spasms and the muscle pulls are usually because of calcium issues. That's number one. And calcium, where do you get calcium? You can get calcium from fish has a lot of calcium. So if your diet is good in fish, you will get a lot of calcium from that. Or you simply can take a calcium replacement, over-the-counter calcium to replace that. It will just knock out the cramps. What she's describing is called cramps, and the diet is the problem here, and I think the calcium is the problem. Can you interpret that? And I'll say more things.
Yo, okay. The doctor Patrick said, "What you would know your I did one more friend calcium in nimu kese mineral ne bi calcium in nimu kese, and a part of the problem." Now, in short, normal be a bit me. I use nuane a day a solve that problem. No, be fish. I or calcium a woman. And I feel bit me so at all over the counter. I know here Dr. Biano or Prescabo, my call Matana, so called CVS no one. The over the counter calcium replacement and no be a bit me at all to support it. Into basically not doctor. So
that's the best, that's the commonest one. The second one is the potassium. If the potassium is also low, it can cause cramps. But that one is from the medication, so the doctor should be able to fix that.
I'll be giving.
Okay, there we go.
In terms of before I say about so no me wo at chat mu you know na ebi no say sentiment me can be 2 or 3 a boom because the doors so said they be able to answer no together, then we go to the next stage. But just
send us enough time.
Thank you.
Okay, but your dog question back home will be able to say can kidney disease be cured? That is one. Second is, what do you mean by salt? Sodium, right? If salt increases BP, the salt contains sodium, then I assume we can increase in sodium intake. So, then I assume we can say increase in sodium intake increases BP. Is this reasoning correct?
Yes, I understand. Yeah. So I will answer them briefly. The first one is, can kidney disease be cured? The answer is, once the kidney disease sets in and is due to hypertension, diabetes, it's not curable. It's manageable, but not curable. That's the answer to that one.
Yes.
The second one is, what is the sodium chloride? What is the sodium? Sodium, we are referring to sodium chloride. When we say salt, we are referring to sodium chloride. So that's the problem. There are other salts, so the question is a good one. There are other salts that doesn't cause the hypertension. But when we say salt is the common one is the sodium chloride. That's the one that's causing the problem.
Yeah. Before I say about so no, your brother, Ikobna, actually, once I was through, wait me beside question and sana, yeah, bye.
Yeah, Doc, I think your presentation was very clear and I really enjoyed it. Yeah, very, very straight to the point and very informative. Now, it's just for your personal opinion, because any platform I get in the scientific community, where clinical trials are done, I question some of these things.
Yes.
The first is on using race as a factor in some of the studies we do, right? Because if you look at the sample sizes, most of the time, blacks are underrepresented.
Yes.
And so where blacks are underrepresented in a pool of, say 100,000 subjects, and you have, say, 1,000 subjects, and then after the analysis, you realize, blacks are not doing well. So blackness become a risk factor.
Yes.
Do you feel a fair assessment? Because across border disease most of the time blackness becomes a risk factor.
Yes.
Then the other thing is that when you use race as a factor, you realize you are not actually addressing the key issues, because economic standing, right, economic standing could be the major cause. Maybe even the location the person lives, the residence could be a major factor. So in your own opinion, I mean, something I just wanted to ask what you think about blackness, because sometimes if you're not careful, you think that being black is a curse because
yes.
Yeah, so that's something I wanted your opinion about. Yeah.
Very nice. Well, I'm preparing this presentation was prepared for for simplicity so that people can take home a lot of information without the complications. But you are 100% right. I wrote an editorial that says that race is not a non-modifiable risk factor, which means that there's no role of race in disease. There's absolutely no role of race. It's all discrimination, everything. In the United States, the race thing is all discrimination. So you're 100% right. It's not really the race, but they've created the scenario of race, which now, people are living in poverty, which you cannot take away. People are living in, very bad socioeconomic stresses, which you cannot take away right now. But if we equalize, we remove the inequities, we level the playing field, black and white will be the same. There'll be no problem in terms of incidence of disease. So you are 100% right. There is the blackness is not a genetic reason to have a disease. It's not. It's all social determinants of health. It's all inequities. But in the United States, that's what happened. Racism, slavery, and people were disenfranchised. So it became part of living conditions, and that means more black people had more disease. So we're basically describing what is happening, but it's not a cause. Not really a cause. And there are now very good things, at least in the United States, that are happening. It's not as fast as we want it to be, but slowly you see that the race issues are becoming more tolerable, and is becoming more and more accepted in society. And then little solutions are coming into place. For instance, if you go to buy a house now, right? The first thing that they give you is a long document that says that we don't discriminate against race. But those days, they will actually find a place to put you, right? So I think little things are happening that is removing that socioeconomic and discrimination aspect of society. There's going to be a long way before we get there. But right now, there's absolutely zero reason why blackness is a risk factor for disease. Zero reason. So I agree with you.
Thank you, Doc.
Yo, that's it, Doc.
Hello, Pacho.
Ma'am, Pacho.
President Mr. Doctor, I'm saying any kakra from 60 above no. Kusiano, am I in New York no? Any white. Until the rest of my life, I'm in New York no krana. And exercise and so 10 years which me and I said, I'm a pump one I saw.
Oh, those are very good questions. Those are very good questions. If I would let me address the exercise first. I mean, we know that some people, it's very hard when you gain a certain amount of weight, right? Like I said before, I said it, and I maybe should interpret this so it's clear. There are some people who are overweight with no problems. There are some people who are underweight with a lot of problems. So what we're talking about is the average. So if your weight, you are managing your disease and your weight is high but it's stable, it's not a problem. Not a problem. Because that's where you are. It's very hard. Let's say, for example, you have knee problems, you have arthritis. How are you supposed to exercise? How are you supposed to do it? You can't do it, right? But if you are under control, because there are other things that you are going to do. You are taking your medications, you're watching your diet. There are some things that you're also doing. You're not just losing weight. You're doing other things that help it. So as long as you are achieving your goal, let's say you're overweight and your blood pressure is normal. That's good. You're overweight and your A1C is normal. That's good. Right? So the weight is one of them, but it's not all of it. And the exercise is one of it, but not all of it.
About the egg.
Eggs? Which one?
Egg, the yolk. I see the yolk.
Oh, the egg yolk. Okay, so the egg yolk, the body, I want to make this as clear as possible. Maybe I need an interpretation for everyone to understand. The body makes 1,500 milligrams of cholesterol every day. Remember that. The body itself makes 1,500 milligrams of cholesterol every day. But the egg yolk has 300 milligrams. So the egg yolk is not the cause of why you have cholesterol problems. A lot of people think that when you remove it and you eat the white, everything's no. The body is the problem. When your body starts producing cholesterol, it has nothing to do with eggs.
Okay.
Can you interpret that?
The doctor was trying to say, yeah, the cholesterol no, you don't have the question X to do, but the doctor was trying to say, the piano who produce cholesterol no to do estimate yeah we can't X now we didn't have problem with ubenya you know cholesterol na wunya is not coming from and I say free kosiana wudi no ho nko say o midi kosia na say menya cholesterol ntimi ja kosia bread dia na me cholesterol beko no e your body no ankasa cholesterol o produce no na a man unya kese e pa free cholesterol no munye egg no nko ade kakra ubenya no nti uja kosia ni da enkyere say cholesterol ne ko just a body na etimi ye no ho adwuma na treat etimi ejai extra cholesterol now produce no. Exactly.
But the next question is why is the body making it? The body is making it from the carbohydrate, not from the egg. So if you eat a lot of carbohydrate, the yam, the rice, and if you eat a lot of it, you go into cholesterol. Can you say that to them?
Yeah, and the doctor person can say cholesterol na body ni yes body ni enya cholesterol produce cholesterol bebre if na cholesterol no eco free if aduane no nuane na yedi na nkasa no yedi e banche no yedi e board yedi e mbayere no sa nuane no carbohydrates na yedi ni bebrebe no eno na body no so far no so sa dey aye cholesterol no nti na no doctor ka plate no wasem was my plate no enya veggies bebre nti na sa wan ko di carbohydrates ni bebre ba body din so nya carbohydrates ni bebre mfa nya cholesterol ma nti sana doctor so chechire mo.
Exactly. Not the eggs. Eggs have nothing to do with your cholesterol.
Okay. Doctor, I'm saying I'm for to say the brown so it advantage no so questions near answer kakra mo. Meko answer na me free no so o answer we are na your brother of Pudombuadu aba the question.
Okay.
I'm saying Charles no a binom there what the answer. There was one relating to race where the answer. There was one relating to exercise where the answer. No. No, Binsu say, what kind of fruits and veggies can you eat if you are diabetic and high blood pressure? I know you're one. Then two, is diabetes reversible? And then maybe manufacturing can. I'll say, what if you take all the kinds of meds, but the pressure is still not controlled?
Okay, so I'll answer the last one first. If your blood pressure is not well controlled, you really have to see a kidney doctor. But there are other reasons that needs to be addressed. That is the answer to that one. If you go to a primary care doctor, if blood pressure is not controlled, you have to really see a doctor. That's the answer to that one. Okay. Could you interpret that one?
So Dr. Pepper what you say we take medication now blood pressure no and call for more. I was who doctor and yes idea original hall at the attention so your punches a basa who doctor.
Okay, so the other two questions, can you cure diabetes? The answer is actually yes. For diabetes you can. But you really have to bring your body, if the doctor says you are developing diabetes or you are about to develop diabetes, it can be cured. That the answer to that one is yes.
Yeah, and diabetes no bet me a reverse no. Say Dr. Kachira wa ni na say normal also we ye be show us we ya sana wa ya sana watimi enya na your partner ni say yes. Ya Kachira say we enya diabetes ya obetimi aya fancy die bi wo ho a ebetimi asi no kwan say de be ya wunya.
That one we all know. I mean, I have a lot of patients. They come A1C is like 6.5, 6.7. Boom! I drive it back to 5.6, and they're done. No more diabetes. They just do the exercise and their diet and everything's fine. The last question is what vegetables should you eat after diabetic, right? So yeah, there are some of the fruits are really very sweet. Or diabetic can eat any fruit, right? Because the fruit is not a simple sugar. The simple sugar is what the sugar you add to the food. That one is, but the fruit is complex sugar, so it's not a problem. But you have to avoid the very sweet foods, and they are typically like the orange, the banana, orange, banana, I believe mangoes. Anything that looks yellow is very sweet. Or orange. Anything that looks orange or yellow is very sweet. You can avoid those. But the ones that don't look orange or yellow, the green apples, they still have calories, but lower in calories. Pears, green pears, lower in calories. All the stuff that is not looking yellow or orange is typically, they still have the calories, but not as much as the yellow or orange one. So if you look at the color will tell you what to eat. Avoid the yellow and the orange ones. Try to go more towards the green and the non-orange or non-yellow ones. Can you explain that?
Yeah. The doctor person say, "Ubetimi add green veggies no more. As any vegetables bina and fruits bina a color. We say every color and fan say quadrunum near the other. As a sample color nina no sugar no content and so air possible. It's no more. And no be a yellowish no color. Sa color no. Yeah, no content in a high to obey to for say susuni no be compared to so was high blood pressure compared to obia and I compared to say obedi green veggies no or encourage so obedi green veggies no more. Okay. Mpacho young brother okudom board mpacho betimi abusa question. Mpacho so we niswa your sister Abigail mpacho betimi abusa ode no.
Yes, this a question.
Thank you. Mine is not actually a question. Mine is a bit of a contribution. Doctor, thank you so much for the presentation. It's really an eye-opener. The person make kakra Emma Yenina, especially Ghanaians. Doctor can't plate in one same way did you? Inti osenka party be a fruit. Into one here na vegetable and fruits no. What he put in ma and no half our canon so what he put in ma and it's also because I think that sometimes we give ourselves excuses. Unfortunately, the main staple food that you need my dinner organ and carbohydrates. So we really need to take a 360-degree turn on how we eat. Why I bet all the document you know go now what he put the other side no so fruit and vegetable no I say one man who excuse say half and also mama yenhwe ni na yenhwe how ye di carbohydrates ni fortunately you won kwire for it. So let's start with the soups so that we will fill up a bit and sana ye di ye asate for ye di entu aminu ni entu amensa because I na April nkese. Secondly, and my doctor say avoid you know when we want excuses, we can have it. Sometimes we have so many excuses until yenya dear and suddenly na ye diso. But sometimes I hear now it's too late. And see, Mr. Mo, we've had this opportunity. Let's spread the word. Na yenya gradually starting and habits. Starting and practice. Because me who they said that doctor can. But then one day penal daho because of your lifestyle. Until my started. Kakra. Na enye part of that. Ansana yare no aboyen ato. Thirdly, mama yen tutu ye ho fo. Nyankopon na yesom no he take care of our spiritual needs and of our physical needs. Go to Leviticus and Deuteronomy and see how God was conscious about that. But a bad nema yesua ni say ni dia. Most people are not even interested. But we learn so many things on WhatsApp and things. But when it comes to social for us for bringing this, when it comes to this things like this, people all should really be on board. I believe said as a diocese in Kenya, nipa be 500 kra in Kenya. Thank you so much. God bless you, Doctor.
Yeah, these are wonderful comments. Yes, absolutely.
About your question. Let me read about your the question is, Doctor, I weight loss, I weight a problem as in the brain, all leading to kidney disease.
Yeah.
Now, of late, so it's been in the news to say people who want to share some pounds when they have been using medication like Ozempic. Originally, and I say it was made purposely for diabetes, but they have been got a side effect. It has all become the trend for sharing weight. So, what are the risks and the benefits of using such medication for weight control?
So the new medication, in the 19. This is a very good question. So I hope everybody understood the question. The question is, there are new medications to lower the weight. And his question is it good or bad? Can you repeat that question so that everyone understands the context of the question?
John, your question is a medication be in your friend Ozempic. Yeah, originally, it was made for diabetes. But diabetic patients normally take care, and when we say another side effect, weight loss. They say it has become mainstream for people who want to lose weight. So, what are the risks and the benefits of such medication for losing weight?
So, the answer to your question is, so far, as of now, we are speaking today, everything is benefit. There's not a single side effect that we know about that would prevent that would cause kidney problems. It's all benefit. So Ozempic is very effective. There were some concerns that it can cause what we call the parathyroid problems. There's a gland in your neck here called parathyroid. It makes the calcium. There was a concern it can cause that problem, but it was in animals, not in human beings. So far, we haven't seen any problem with that in the human beings. So I use it all the time. People who want to lose weight, I give them Ozempic with diabetes or without diabetes. And they lose like 20, and 20 pounds is a lot of pounds. So far, the answer to the question is the medications actually work, and they help the heart and they help the kidney as well.
Can I say, Doc, website will be chatting now. Was say holding on to your urine can give you a kidney problem.
Wow, that's a very good one. So that's taxi drivers, right? If you are a taxi driver, you have to drop, anti-Duating, from downstate, and then you are in the highway. What do you do?
Doctor, taxi driver.
So that is a good question. They get what we call the acute kidney injury, but not chronic. So yes, the kidney can be damaged, but when they come, we advise them. They don't do that again. They try to use the bathroom frequently. They don't get the kidney damage again. So that one's acute, not chronic. So the acute always goes away. The chronic never goes away. So that condition gives acute, not chronic. The other problem with the taxi drivers is, or when you're driving long distances, but this problem is only for taxi drivers really, because they are doing it every day. They also develop kidney stones because they don't want to drink water, so that they go to the bathroom. They are very conscious. They don't drink because they don't want to be in the highway and then they have to go to the bathroom. So the taxi drivers don't like to drink water. So because of that, they have a very high chance of developing kidney stones. But the kidney stone doesn't cause chronic kidney disease. We are able to treat it, remove the kidney stones, and then their kidneys are fine again. Can you explain that?
Yeah. So the doctor said what Shani said. Sa question no say we show who so we know so betimi ama kidney problem na doc say we betimi anya kidney problem, but a kidney problem betimi ko yetimi esa enya de be ma chronic enya de be wo hoda intino idea a bit my problem into encourage say go too much. Idea never na say ugina baby now ya no ugina baby no aye. Nti ewunu sa America ha ne de untimi nkoya ne baby Ghana de wo drive na uduru kwan ho baby a wagina na ohwe egu ha so bi a gas station. Nti e ba sa ye na wako gas station na odi aye. Na de osaka eka ho ne say obi ho a say ne me drive e de say de no kwa akoto me kwa mu kura minya gas station. Na mekwa akogina adwonso no nko ade ne ade no kura menum nsuo ense ma menum nsuo bebrebe an me gina bebrebe no ma adwonso na doc say no so saa no enye se wo ye ne saa so a ebe mo anya kidney stones na eno so aha kakra but no e ade a etimi san reverse etimi ma ekio ma ne free ho but on encourage say obey saa de no say de ebe ya obetimi anya kwa ye wadwuma because of wadwuma ne nsi kwa ma wonum nsuo Ojumani esi kwan ma wo hold on to ojonso da bi e wo se ebre so a okona ko release don pacho me wimba yeah me call you know wo mama staso no yen sofo comfort ma me pacho obetimi abusa wo question no
sure pacho be that's Dr. Sifani I'll present here. Thank you so very much, very insightful. My question is, what country or have issues, but only medical insurance? Any advice or recommendation for those who don't have insurance?
That's a very good question. Especially we are first generation immigrants, or it's a very. I know the audience is coming from across North America. People are in different places, so it's a very difficult question to answer for everybody in different locations, but. In New York City, as an example, we have what we call the city hospitals, right? We have 11 city hospitals, but people don't know about it. We have 11 city hospitals in New York City, 2 in Brooklyn, 2 in Queens, 2 in the Bronx, and about 4 in Manhattan. City hospitals that anybody can go, you get care for everything, and nobody's going to ask you about insurance. But people don't know, so they don't go. Right? So if you are in the New York area, City Hospital is the place to go. And the care is not inferior. I work at Kings County Hospital too. That is the one by SUNY Downstate. There's a big hospital by the city. It's just by the University Hospital where I work, but I work on both. I work at the Kings County Hospital. I also work at the University Hospital. We provide, I'm the same doctor. So if I can do it at Downstate, I'm going to do the same thing at Kings County Hospital. So the care is not low. It's just that the care is provided to people who cannot afford the care. And we know that, and we just go there and we provide the care. So all the big cities in the United States, Boston, in Philadelphia, in Washington, D.C., Chicago, all the big cities have what we call the city hospital. So wherever you are, find out where is the city hospital. Number 2, with community hospitals, right? Not all community hospitals are private hospitals. Some community hospitals are actually county hospitals. So if you are in a place where it's not a city, but it's a county, find out where is the county hospital. If you go to the county hospital, you are going to get care, and nobody's going to ask you too much. I mean, maybe at some point you get insurance, but nobody's going to ask you why you came there for care, if it's a county hospital or a city hospital. So that is very helpful. But the most important thing is that once you enter those systems, if you enter a city hospital system or a county hospital system, you have to find out. Don't walk out. You have to find out, how can I apply for Obamacare? How can I apply for insurance or Obamacare? And most likely, if you have an address, they don't need a lot of information. If you have an address and a social security number, you can get Obamacare. You just need an address. You don't need all the financial information that everybody's looking for. You just need an address and a social security number, and you can get Obamacare in the United States. So don't forget that also exists. It's not big. It's not going to give you a heart surgery, but it will provide your medication for your blood pressure, your diabetes, and all the other things that we're talking about today. You're going to be covered with that. And that's what you need. You don't really need to be sick. You just need to prevent the disease. So if you have insurance that prevents the disease, then you are okay. So Obamacare is available to a lot of people, but they don't know about it too. So when you enter the health system, wherever health system you are, when you enter the health system, find out if they provide Obamacare and whether you can apply for it, because it will take care of your primary care.
Yo, that's a doc. Doc, I'm saying, Obi, a chat about home, maybe a chatty, answer chatting question. We are Star Doris now, also the question about. Obi said, Doc, please, can you touch on the role of stress management in preventing kidney disease, if any?
Yes, so stress is connected to blood pressure. So that's the connection. Stress leads to blood pressure in most cases. The acute, not the acute. Acute stress doesn't cause hypertension, right? Like I'm angry, I'm anxious. No, that doesn't cause hypertension. But chronic anxiety and stress can lead to high blood pressure. And the high blood pressure can then cause the kidney problem. That's the connection.
Yeah, that's it. Look, Doris, Mpacho, bet me up with a question, no?
Yeah, Mpacho, me that's Mpacho, me bisa now cast salt, no. Me pese me who say salt burn a year for a year. And secondly, no, so now come about the fruit, say yellow fruit, no, and yet. But the maybe sound say be would the vegetable like a spinach, kale, next time your manufacturer, so be would the pineapple, apple, run as a weird smoothie in the morning. Now no and no much and no sugar now the same.
Okay, very good questions. So let me answer the last one first, which is the fruits, and then the yellow fruits versus the non-yellow fruits, and whether you can do smoothies, and then whether you have a high caloric intake. Now, the fruits and vegetables, this picture here is for healthy people, right? If you are normal, you don't have to worry about yellow or not yellow. If you are fine, you eat just everything, right? Because everything is good. They have your vitamins and minerals, so you're fine. It's when you are diabetic, that is when you limit the yellow and orange fruit, because you can eat in moderation. It's just that the sugar is too high. That's why. The ones that are not yellow have less sugar, so that's okay. It's still not okay, but it's okay because you have to eat fruits and vegetables because they have other things that you need for your body, and your body still needs sugar. Even if you're diabetic, you still need sugar, so you have to eat a little bit of sugar. So the answer to the second part of the question is, for people who are normal, you eat everything. If you have diabetes, you watch out, right? Don't eat too much of the yellow and orange fruits. That's the answer to that question. For the smoothies are very interesting. If you do a smoothie and you eat right away, it's good. If you do a smoothie and keep it for the next morning, it's all sugar. It's not good. You are just drinking sugar. You're not drinking smoothie. So that's the trick with the smoothies. If you do the smoothie and you drink it right away, the sugar is with the fiber, so it doesn't get into your body. The taste is good. The sugar is mixed up with the fiber. You drink it, you enjoy it, and because the fiber is there, the sugar cannot get into your blood. It can't. But when you do the smoothie and you keep it for some time, usually more than 4 to 6 hours, you see that the sugar begins to separate from the fiber. Now, when you drink it at that point, you are basically drinking sugar. So when I go to the airport, you see the smoothies, they are in bottles, everybody, you buy them. Those ones, you are just basically drinking sugar. You are not drinking smoothies. So the best way to drink a smoothie, do it yourself, right? Do it yourself, it's fresh, and you just drink it. Although there is sugar, but it doesn't get into your blood because it's mixed up with the fiber, and the fiber doesn't allow it to be absorbed, so that's good. Okay. The first part, did I answer that question properly? Is that okay?
Yes, doctor. Thank you.
Question back.
That's my first question. You didn't answer it.
Can you restate the first part of the question again? I lost it.
Salt, which salt.
Yes, the which salt. So the sodium chloride, the table salt is what we're talking about, right? Table salt is what we're talking about. That is sodium chloride. There's also sea salt, right? That is magnesium salt. The magnesium salt doesn't cause hypertension. So if you're using the sea salt, it's probably okay. But the sodium chloride is where the problem is.
Maybe, sir.
Bacho Hine.
My bacho. Arthritis. How me papa, and I know so dear, and I may prevent arthritis. Because arthritis, I dream my body in armor. If you had a replacement of the left hand, and the right one also so and also dream is until dear and I may and also ever manage.
Okay, that is a very good question. Even though it's not direct with kidneys, but it's a very, very good question. Okay, because people with arthritis take medications for the pain, and those medications then damage the kidneys. Right? So Motrin, Aleve, Naproxen, Advil, these over-the-counter medications, Motrin, Aleve, Naproxen, Advil, people take them for the pain of the arthritis. They actually work. They are very good for the arthritis. But these 4 medications, they can kill the kidney in 1 year, especially if you are taking very high doses for the pain. But there are new, I can talk about this privately. If the sister can connect with me privately, it's more about disease management. I can connect with Ms. Boateng, and we can find a way to get a solution for the arthritis. But the connection with kidney is through the medications. The medicines, those 4 medications, Aleve, Naproxen, Advil, Motrin, they kill the kidney. So be cautious about that.
Your mind.
So, maybe I was through we are doing.
What can I say? We're connected privately. Sister Paul, Yana, what was over connected, Doc Nema, na or me, Abuano.
What about Tylenol?
Tylenol is okay.
Maybe I is Bobby from the.
I start Joyce, who bet me a question.
Doctor, my question is, I'm a fan of fruit person. And I try to use a tablet that says support of immune vitamins and stuff. I try my best to put minimum Ghana, I don't need any mediocre crime, who be still. I'm a macro mumpe. And it's a far like there's a vitamin to support yourself now. What is the most
yes. It's okay. It's not a problem to use a vitamin for health, because all the vitamins they are all important vitamins. And if you look at them, they are all in the fruit. So if you are not eating this thing I'm showing on the screen here, then taking the vitamin is actually a good thing. So it's not a bad thing. It's just that what we are saying is that if you eat the fruit and vegetable, you don't need the vitamin. But if you're not eating the fruit and vegetable the way it's described here, you need the vitamin. You need something.
And they say, in my way to say I'm trying to be on the borderline. And Jama say, it's a media measure. And I'm a power dear now. We have time I need a bit DNA of the edge, and I say, be near the borderline. And it's I am a baby to say, the quantity of the things supposed to eat and stuff, say, if you can help us a little bit, I need it because. Borderline too much.
Right. Yeah. It's a very complex. You see, we again first generation immigrants or just immigrants. It's very hard because we are all busy working, and it's really very hard. Very hard. Some people are working 2 jobs.
2 jobs. I'm selling lunches every night. Sometimes I don't know what to eat, but if you know I'm need that, but I get and it's only a problem. I feel like my tummy is full. into a hammer daddy. I need a really help to be stopping.
Okay, so I mean, I can work with Ms. Boateng. We can address your issue specifically because now yes. I will work with Ms. Boateng and we will address it specifically for you. But let me give an overall answer to everybody who listened to the question. Just imagine you put yam in your stomach. You feel good, right? You feel good because your stomach is full. And you feel good, you work, you have energy. But but you're not, the calorie content is more than 2,000 when you do that. It's more than 2,000. So the excess is going to go into cholesterol and weight. So, but let's assume that you were occupying, it doesn't have to be this rich, right? Let's say, for instance, you see this one has the lettuce and then some apple, some orange, or maybe red fruit or whatever, and some other things. There is some blueberry here. It doesn't have to be this. It could just be lettuce, and you just eating enough lettuce to fill your stomach so that you feel full, right? You just have to feel full. And if you feel full, then you don't have to eat, 2 bankus. Maybe you eat half a banku. That's your carbohydrate. And then you have your fish or whatever, your meat, and then that will take it. So as long as your stomach is full, your brain is okay. But the way we eat is we try to put the carbohydrate first to make our stomachs full. You see? And that is where the issue is. Then you gain more calories. You gain more than 2,000. Then you are now struggling with it. So what we need to do is we don't have to make it complicated. Make it simple. Whatever you can get in vegetables, that makes your stomach full is what you should do. Right? And then you add whatever little bit of carbohydrate you add, and then you eat a little bit more meat or fish. And then you see you still feel full, because once you're full, the brain doesn't know that it's carbohydrate, it doesn't know that it is meat or it is carbohydrate. The brain doesn't know. The brain just knows that the stomach is full. So use whatever you have to in these greens. When I come home in the evening, sometimes my wife is complaining, you don't eat. But because I say, give me my greens first, and I will fill my stomach, and I eat a little bit of rice, and then a little bit, and I eat a little bit of meat, and I feel full. And then she's wondering, but how do you do that? I say, I feel full. I don't feel hungry, but because my stomach is full. So that simple approach, without having to be complicated, I have to eat the pear, and I have to eat the apple, and I have to eat the green peppers, and then the blueberry. No, it's not like that. Whatever you can afford in greens, just make sure that your stomach is full.
Okay, that's it. I'm saying, but me were a couple of messages here. I said almost to bet me take advantage. No more question, so I know. Doc, me bobo couple so now what can I do? What boy? Obi, Mr. Let's say, Mr. Cynthia. What are the signs and symptoms of kidney disease? I know you're one. And then I'm here. Let's see. But you bet me I and one whilst I go through the others.
Yes. So kidney disease is called silent disease until it's too late. So you have to keep checking. That's the answer. It's a silent disease. You don't have symptoms until your kidney is working less than 10%. So that's very dangerous. So you have to keep checking the blood test, the blood pressure, and the diabetes. That's how we catch it. So it's all blood tests. You have to keep checking because you're never going to feel anything. That's the answer.
Doc, Obinsu besides our question, say if you are diabetic and use sweet and low or teas and coffee, is it okay? What are the recommendations?
Yeah, sweet and low is not a problem. Sweet and low is not a problem for diabetics at all. There's no study that shows that it's harmful. On the other hand, you cut back on the free sugar. The sweet and low is it doesn't get absorbed. It just stays in your stool and comes out into the stool. So it doesn't really get into the blood. So but at least you feel the sweetness of it, and then you're happy. It makes you happy. But there are no side effects that are reported for patients with diabetes. Now, in normal people, not diabetics, in normal people, some people say, okay, I don't want to eat the sugar. I want to take the sweet and low. But when they do that, they take too much. You see, they're trying to compensate for not eating sugar by adding sweet and low. So they do it too much. So there are some studies, very large, that show that normal people who take the sweet and low have a tendency, not a high risk, they have a tendency to develop diabetes. But it's a small tendency. But that's because they are just taking too much of it. Right. It's like the example with Coke, regular Coke and Diet Coke. Mm-hmm. There are some studies that show that if the regular Coke actually, the Diet Coke, because it has less sugar. But when you're drinking the Diet Coke, you tend to drink a little bit more. So, and you compensate that by taking other calories. So people who take a lot of the Diet Coke tend to have a tendency. They don't develop diabetes, but they have a tendency to develop diabetes. So it doesn't make sense, but that's what it is. You see, you think that you are trying to help yourself, but then you do something else that causes the problem. So that's the same problem with the sweet and low. For normal people, it's not recommended. Just don't take sugar. That's it. For diabetes, there's no problem. That's it.
Doctor, that's it. Pacho, sana and Sofu Penny, Sofu Penny Thomas Bebasono. There's one chat question. Sofu Pacho me was a question we are now also do the number. To be said, say please. I would like to know if you oil and feel itchy afterwards, does it have a connection with kidney problem?
I didn't understand the question again. Could you say it again?
He said, if you eat oil,
yes,
and feel itchy afterwards, if you eat oil and you feel itchy afterwards, does it have a connection with a kidney problem?
There's an interruption in the sound, so I couldn't get it. The first part I got, if you eat oil, and the second one?
And then you feel itchy.
Oh, you feel itchy.
Yeah, okay. When you itch. Does it have a connection with kidney? Is it an issue relating to kidney problem? That's why you do that or something?
If you feel itchy, you really have to, if your body ever itches you, you have to check your kidneys. That one I have to say, because kidney disease can cause itching. So if you go and then the dermatologist or whatever, you still have to check your kidneys. So the answer is, if you are itching, you have to check your kidneys. Now, the oil itself, the oil has a different answer. So we want people to, the saturated fats, that is the like shea nut oil and all the saturated oil. The saturated oils are basically, they are too fatty. The vegetable oils don't have too much fat. So the vegetable oils don't cause too much problem. The other fats like the shea nut oil, the palm oil, they are not saturated. They are not unsaturated. So they go up. When you eat a lot of it, it goes high in the blood and it can cause a problem. But the vegetable oil, unless you're like eating too much, the vegetable oil never goes up. It's taken care of. It goes away and that is done. So in terms of your health, the vegetable oil is more healthier than the saturated fats like the shea nut oil and then the palm nut oil. Does that answer the question?
Yes, me sure. What yes, yeah. Many.
Thank you very much, brother. Thank you, doctor. I just want to find out how safe is it to replace sugar with honey? If you don't take sugar but you're taking honey, how much and how safe is it? Thank you very much.
Wow, that's a very good one. I would answer your question by saying that everything in moderation is always good. So if you don't have a problem, you have to do moderation. See, that's why in this slide we said limit. We didn't say eliminate, right? You see my pointer here? It says limit. It didn't say eliminate. So if you're healthy, you can still take your honey. There's no problem with that at all. Take sugar or honey, but everything in moderation, limits, right? Not a problem. If you have diabetes, if you have already been diagnosed with diabetes, right, the honey is just the same as sugar. That's the problem.
Okay. If I'm sure, young brother Francis R. But you'll be to me a question. Now, Oniso. Okay. But you'll do a question, I'm saying you are running out of time. So.
Me Pacho, my question, me didn't know me.
Yeah.
I wanted to find out what would cause a person to have a drastic weight loss.
Very, very good question. Actually, this is so important. So we are talking about, you can lose weight. Lose weight is good. So that is called intentional weight loss. Okay, so remember those two words. One is intentional weight loss. That is, your weight is a little bit high. You want to bring it down. And you're exercising. You're watching your diet. You're eating less than 2,000 calories. Exercising 11 minutes a day. That kind of stuff. That is called intentional weight loss. But if you didn't do anything to lose weight, and you're losing weight, you really have a problem. The one that always comes to the doctor's mind is cancer. You have to rule out cancer.
Oh, no.
If you didn't do anything to lose weight, and you are losing weight, you have to go to the doctor immediately and get treatment. But if you are doing something to lose weight, and you're losing weight, that's a good thing. See, they are different. One is intentional, and the other one is unintentional weight loss.
Yo,
question back.
Olive oil, because you see olive oil, but all can one catch olive oil. Olive oil is better than vegetable, not vegetable oil is better than olive oil. Thank you.
Yeah, I got that question. The olive oil, the vegetable oil, they are all in the class of what we call the unsaturated fats. They are all in that class of it's not too heavy, so it gets cleaned up from the system very quickly. So they are in the same class. The olive oil, the vegetable oil, the corn, all those oils are what we call unsaturated. So they are not heavy. So they get clean very fast. So they are sort of okay. The non-saturated fats are the ones that I mentioned. Let's say, for instance, the shea butter or shea nut oil, and then the palm oil. They are saturated. It doesn't mean they are bad. It just means that they don't get cleared fast enough. So you have to limit your intake of those.
Hello. Orderly kakras. Doc, there's one chatter. The person, Mr. Poye, Obi said, does intake of coffee has anything to do with high blood pressure or kidney problems?
Yeah, I saw that question. Yeah, very nice. You know that Starbucks and the like, those coffee companies are selling coffee to millions and millions of people every day, right? Yeah. If coffee was a problem, we would have known by now. There is no problem. There is always someone trying to write a paper, trying to talk about coffee and all that stuff, but we have zero evidence that is serious enough to change behavior in terms of coffee. So coffee is no problem.
Yeah. Okay. So, Doc, I think say your time no but me one chat question. Now we are final question. Many free participant or live into you know Doc na you. Obi say is protein in urine a sign of kidney disease?
Yes.
Only chat question.
Yes.
Okay.
And that has to be taken seriously. If you see protein in the urine, it's a sign of kidney disease. It has to be taken seriously.
Okay, I must say. But your last question will be for live. Yeah, was you will be per se. We'll put a live question and then the last question.
Kumsen. Pacho. We are hypertension candidate. That's a wood they drew so. Say a con normal. What me free do no so and I say
no.
We are a drone for life.
For life.
You still have to go for it.
No, the answer is no. Don't do that. Don't get off the medicine. Okay, let me make it easy for you. So we don't use only one thing to treat the blood pressure. We're giving you the medication. We're telling you to don't eat too much salt. We're telling you to lose weight. We're telling you to not drink alcohol. We're telling you to, give me 1 second. We're telling you to eat a little bit potassium if you're normal. We're telling you to, we're telling you to do all this stuff. So if you take the medicine, your blood pressure is normalized, and I mean normal, like less than 120, and then you can do this, you're good. You can eat the fruit and vegetable like we explained, you're good. You reduce your salt intake, you're good. You increase your physical activity, you're good. You reduce your alcohol intake, you're good. So it's possible, yes, that if you do all these things, you don't need the medicine. I enjoy the person who said,
Yes, every time you say good job.
Good job. It's after Breno Echo, you know. Pacho Ubi Kasana.
One Pacho, maybe any sir, I had a stress center or recording of one man, Canada Roman, or the Mamoto platforms to Mayana. Yet, must send the Amaya Mana organ and Yenmi and Maniama, and now some way, enough Monty Ediso. I is the old one, no can win to me, Canina, no much me Ediso, Madame Slewa.
Yo, ma, you're taking care of Sano man. I YouTube connection, and you know, Yabama Ubia and your link, you know, now almost so intimidate a share. And no. In Pancho, baby, I do them say, your brutal questions, Nibia, say no. The my friend says somno the somno baby you say and some pano ibiano no ntia the somno eba awiye na normal kakra aka ye dey definition up no this is the arrangement and as I say they be follow bema yen sister Mabel Yankee ama vote of thanks or no the assistant coordinating office for social services and secretary or manu via na Yenda Bishop was what or Bema say or 1 or 2 assembly can or Becca na we are now a bumpire na we shy into this time maybe Mr. Ross or Beya and I mean Sebia the assistant coordinating office movie na say more before said that bebano over my vote of thanks even as or announcement you have person the cheswa now they are cheswa into that somewhere. Now what we are not just say we are close here pranti maybe to bet me assume.
Thank you very much, Brother Kwame. Thank you so much. Wow, it's been such an eye-opener. I have personally learned so much. I've made tons of notes here that I will be reviewing over and over again. I think we can never learn enough. First and foremost, we just want to give thanks to God Almighty. We are so grateful for this opportunity to be here learning. As one of my dear sisters said, Auntie Abigail, God takes care not just of our spiritual, but also of our physical needs too. And it is His wish that we may prosper and be in good health. We are grateful for our own dear Daddy and Bishop, Right Reverend Professor Emmanuel Wailate. God bless you, Daddy. God bless all the superintendent ministers, our synod secretary, who also joined us earlier on. We're grateful for all the ministers of the different societies and the circuits represented here today. We're also grateful for our special guests who we've invited. I know that Prophetess Carolyn Thomas, I saw her earlier. God bless you, Prophetess, for joining us. And mainly the reason why we were brought here today, our speaker, Dr. Salifu, God bless you so, so much. We are very grateful for the pearls of wisdom and knowledge that you have shared with us today. And just to highlight some of the points that you made, one of the things that you said that was just so profound to me when you were talking about healthy eating was that it was the foundation of living. What we put in our body indeed has a big factor to do with the way that our health outcomes are also dictated. You also touched on the two main risk factors, which was diabetes and high blood pressure, accounting for 78% of our chance for developing kidney disease. So please, beloved, let's all take note of that. And I know that there was a discussion about our race as Black people and also gender, men being at the highest risk to develop chronic kidney disease as well. And you also touched on the importance and what we need to do to slow the progression of even developing kidney disease as well as how we can control our weight, our blood sugar, and also how to manage stress so that our blood pressure too is well controlled. So thank you so much for that. And I hope that you left that slide on, the take-home slide, you left that on for a long time. I hope some people took note, but you had mentioned that our blood pressure, we should try and keep it within the region. At least the maximum shouldn't be more than 140/90, and our A1C shouldn't be at more than 6.5. So please, beloved, let's take that on board and let's be mindful of our BMI as well. And yep, there's that last take-home point. And the last one says prevention is definitely better than sorry. As we say, as occupational therapists, it's not that practice makes perfect, but practice makes progress. We can take small steps to achieve the goal, which we all want to be healthy. So these small steps that we can incorporate into our daily lifestyles. We also want to thank, I've seen some of the lay executive here. I'm not sure if our Vice, Dr. Colin Safriye, is still here. I did see Sister Mary on earlier, and also our IPC brother, Setre Mensah. God bless you all for joining us today. On that note, I'll ask our chair lady, Auntie Paulina, if you have any announcements. I know we have more programs that are coming out. Definitely, we're going to be covering these topics more often, and we're very thankful that Dr. Salifu, when we called you, you did not hesitate. You honored our invitation. I was mentioning earlier when I was back channeling our bishop that this information was desperately needed. It was desperately needed. So thank you so much for honoring our invitation. God bless you. God bless your family and your time and effort that you've dedicated to us as well. May God also honor you in your career and in everything that you also do. And we hope that when we invite you again, you'll come and join us, because I think we should do a part 2 of this where we go deeper into things. Yeah, that would be helpful. So God bless you so much, Doctor. And thank you once again for joining us today. And also to our executive team, the Diocesan Coordinating Office for Social Services. God bless you all for the work that you're doing. It's a great team. And thank you so much, Bishop, for making this team exist. I think, we are hearing a lot of talk about how we, especially as migrants here in America, what we can do to improve our health. It's not always about working. It's not always about being under unnecessary stress. We can manage some of these things with the simple lifestyle modifications that Dr. Salifu even spoke about earlier today. So let us try to incorporate all these good things that we've learned today to improve our health and our well-being. We are here, yes, everybody's working hard. We want to build a legacy in Ghana or here and leave something for our children. But ultimately, we also need to take care of ourselves, because what is the point of us doing all these things if we are not going to be around to even enjoy them because of sickness? So let us remember that, beloved. Thank you all for joining us today. We appreciate your time and your effort. It's a Saturday. You could be out doing anything, but you're here learning and also developing yourself. So God bless you richly for joining us. Amen.
Amen.
No, I think that Sister Mabel has really said it all. Once again, we just want to say a big thank you to Dr. Salifu for, I know that his time is very, very limited, but he fit us into it in Dasipa. And also just take home, know that he has opened something in Ghana, in Ghana, we will put up information. I'll get his contact information and we'll put it up so everybody can have it as well. And to thank you. Me jama back, Dr. Sifa.
It's a fun idea back when I say any pabi contact as some doctor communicating to Mr. Ross, Obe picking also up, said the Bayer in Lucy Track, sir, or more as some doctor personally on Omnishiana.
Sure, I put my cell phone number on it. I think everyone that asked for it, I gave them my cell phone number so they can call me and then I could give them the information that is needed.
Okay, thank you. Now, Bishop, Mpacho, Who also say?
Doc.
Yeah.
Dr. Sefa, the coordinating office on social services. Yedamwasio, thank you so much. Thank you. In fact, I think you were right. I don't know whether it was a slip of tongue or an intended thing, but you said in fact, this has been an incredible service. It has been a wonderful service together, which I hope and I trust and I believe, sir, we will take the sermon that we have received from Dr. Moro Salifu. I couldn't have preached a better sermon. I don't think a better sermon has been preached anywhere among us. Doc, we thank you so much for doing this, and we want to replicate this again and again as a diocese in our circuits and in our societies. You have given us life. You have shown us simply how we can promote life. That's what we're about. And we thank you so much. You not only taught us, but you also gave some free consultation. I saw that in some of the answers you were even consulting with individuals. Thank you so much. May God richly bless you.
Amen.
And so we will want to continue this public health education. It's one of the features of my other life at Emory University. I am involved in public health education, especially around mental health. This has been a wonderful service, and we give thanks to God and we give thanks to you, Doc. With those words, look out for future. There are other events that the Office on Social Services are planning for us all. Look out for them, but also look out for ways in which in circuits and societies we can replicate some of these things and take the message forward so that our whole lives, our theme is living the transformed life. As Doc was speaking, I went and got my blood pressure thing. I took my blood pressure right here while we were going on, and I am happy to report that it was 113/77.
Nice.
It's a lifestyle thing. It's a thing that we should. The advice we have received, it will give us life if we will live for it. Just exercise. 11 minutes. We spend more than that doing all sorts of useless things. If we can just take 11 minutes. So very simple, very straightforward. And may God richly bless us all. With those words, I would like to pray and bless us. And so let us pray. God, we give you great thanks for this time on this Saturday morning together and with you. We thank you so much for the work that Dr. Salifu is doing in this country as well as back home in Ghana. We thank you for the teaching that we have received. We pray that you will enable us to put into practice these things that we have learned. We pray that we will also be ambassadors of this message so that throughout our diocese, throughout our communities, throughout our relationships, we will help to promote transformed living, living that is healthy, living that will produce more fruit to the glory of God. We thank you in the name of God the Father, God the Son, and God the Holy Spirit. Amen.
Amen.
Yɛne Jesus Christ na do. Onyankopɔn dɔ. Onye
Nkonko na yɔnkofa.
Ne yɛn nyinaa ntra ase daa. Wɔno nkyɛ Yesu Kristo duro mu. Ataa na adi wɔ so mu. Kɛmumɔ kronkron lɛnyalo. Wɔfɛ aishi daa. The grace of our Lord Jesus Christ, the love of God, the strength and fellowship of the Holy Spirit be with us evermore. Amen.
Amen. The Panchoda Season Monthly Revival will begin from this Monday to Friday. Omobeye flyer no diaba. Inti yenkai say from Monday to Friday. That's it. That monthly revival. You best start it. Inti no eba muhu flyer na. So they say now participate. Panchona no. Abusian for edobi bia say yapon.
That's okay. That's if I am so God bless you.
I mean, someone you know.
That's it.
All the best, everybody. Thank you so much.
Thank you.
Every.
So nice.
fact, there would be more than a 345 who could be able to make software. From 45, there could be a good use of it. Because the raw movie is if you get to me, I Juma for so many years, all the time was in a mere phone. A book of Asana, Amma said you made this a software, meaning I hear and Panin, Obama, HBI there's this Saji, it is the new constitution. I just said from 23 to 30, a year, as of 54. You 35, you know, it was 45. By 45, 46, 47, 48, you could be on. What do you mean, make it so
I'm so beyond the mirror. Then it means that we are limiting what constitution on your bathroom. I go in your bathroom. Man, sit down. Constitution, you know, bathroom. This is our constitution. We can serve God in so many ways. You don't have to. Well, you know, we are one of them. Yeah. And then, I think maybe a question of the people who are see Ponty. Okay. They say, sir, when you begin me, I say, Wabeli Topo, why you ready, sir? Very be a friend, why you ready to have a say, oh, what? You drink. You don't drink. You drink. Definitely, we will refer to alcoholic drink. Yeah. I take one. I take two. Communion drinking also. Show by hand. Those in favor. Those in favor, show by hand. But you kind of don't give me an answer. One question. Okay. From experience, who be this support? And you prepare to sell anywhere you are visiting? That's a good question. I'm prepared to sell anywhere they send me to. Won't record though because when you work in house, me I don't call I stay.
December, the reason be that scan and feed festival. And to me, I don't bring in a picture of one system. December, no, a new, there's a bed, a week of America. The way burn, that's a new, supposed to get about 10,000 a month. And this guy, when you're going to pay to be, and do that. The big thousand and some years ago, the Nina Dukia, it's got a new, and then now, Nana said, the Shia, I got to say, we are 10% of the harvest last year. That's one of my friends we are talking about. I got to more before at Navia. So it was in next year now. Society piano, the 10% of harvest. That is engine. So that that can meet the window of workers for December. Let me tell that in advance. And you know, like Queens say, let me say Queens, about 4, 5, 6, or 4. It's kind of feel whatever that is. I'm sure how much money will be there. Open the monster, who are for the night. The other place is sad. It's kind of go banner. And soon of all come allowance. But I'm saying, I know central fund into everybody will move on now. Not possible. And I'm not the same way. Let me just say, Sebastian, the river come higher. Yes, therefore, I'm on your about it. The question is, I never remember television. Is there any plan of yours and say, maybe a sorry, no. Now, after you commission, that is a plan to more than this year, saying, lucky, for probably one about. So we have on the airport. Next year, 4 never out. Canada for the local only one or some bill for the local. It's even 2 Robin Nassau. Bahano, you will sit down, go to 4, where they win. I challenge the beer. I've been in America, I don't need to be fine. It's a bit of wedding combo. Bishop said the same thing. Because then comments are spending a crack. Because when they come now, they'll be on pass or be that in other ones. Just be the go get much for I can see that. You know what's going on. They can not say, but when you men sue, be made for a wine. That's because it's true, but you share your resources. There's a good no matter of we are the law. I don't know. It's the Siano, yeah, just said, sorry, up to them, I get it, sorry, you can try and get that much. They say, I would rather say, some of us said, maybe you don't know, you don't know, from the base of 12 as 8, no, rather. Some who are in the sky in the former, but I tell you, yes. If I told you, but not.
So I didn't say it's a new Mary in one. I say, let me see me after and then I'm from friend. I mean, and then I can say friend. He said, maybe something. I mean, I understand, say, I can be posted anywhere. And the method is do what and I said, why can't I go? Does it necessarily have to be said I have to be stationed in North America?
Almost so 54, we don't transfer.
They say, no, what's it? 55 in the new. They say 54 in the new.
the phone where you know? Where you know the phone? Who's the 5 million? The 5. You only know 5 million.
Hey, you want to hear about it. Are you willing to go to Ghana to serve over there? If I say no, then it means you won't frame me.
I'm watching there. That person is here with the wife and children. Listen, the wife and children. Don't worry, they are fine. But in America now, what's going on for Ghana?
The 30 ministers are posted here. When they asked to go back, they left their wives and children here.
A different will be here.
Want to be impossible. Obviously, we could be sure of why. They should ask them.
I can't take any decision here. I just want to know what to do. But I'm going to not easy. Not easy. But we are still managing. The one fire said we will be more churches. You know, I'm going to say I'm going to be out of work. I say another site. You need to have some. People have been understanding for a while. Okay, I've consumed my agenda. I'm going to Yaba. Some mama be known.
So what happened is yeah, no, no, they don't want to pay. So get it essay assessment.
Yes, I pay income for.
Income for
Said
us.
it's about
Put the
income.
assessment out, right.
Until you find the paper.
We control.
Quarter and answer.
Yes.
About next quarter.
About next quarter.
And they said,
Yes.
yeah, okay. The market said we are expecting that money.
No. I just want to make a correction. Stewart can send a move to some which you are. Please. I just someone for some which I wasn't coming. No, because there was a communication between the former steward and the justice. Okay. And here to the budget. And I said, okay, yes.
Hey, Minnie.
ebi wɔ hɔ a ne yɛyɛ program ɛne ade nti no ɛna ɔso wɔ berɛ a yɛapɔn yɛpɔn a ɛna ɔmo bɛba nti leaders meeting yɛagye ato yɛyɛ ankasa ne yɛgye to ho sɛ ɔmo mmra na sɛ yɛpɔn a ɔmo bɛyɛ
akyɛ metama
ɛnyɛ kasi in fact yɛkase ɛnyɛ wɔ hɔ ɔmo yɛ Ghana yɛkase ɛnyɛ wɔ hɔ
ɔmo dɔm yɛ asɔfoɔ I'm the African Pastors Association.
African Pastors, Ghanaian Society. That's a poor now before no come together.
And then because it's steward justice for company.
And we are from by
for the leaders meeting. Leaders meeting, now meeting.